If you see, women are mostly affected by breast cancer, cervical cancer. I also told oral malignancies and lung and esophageal cancers, colorectal cancers. All these cancers are pretty common. So, who are the people who are at risk? First of all, when you come into the head and neck cancer or the lung cancer, it is smoking. Smoking tobacco in any form. It can be chewing of a tobacco, it can be a cigar or a cigarette or BD smoking. Any of these can affect these parts of the body. Smoking can also cause carcinoma of the urinary bladder, not just your head and neck and lung, even bladder cancer is pretty common in smokers. Smoking also has an influence on the cervical malignancy. So smoking foremost is an important factor which can have all these areas affected. Other areas, risk factors, when I can split and tell you, when since we are talking more on the female malignancy, with the breast cancer, age is a factor. As advancing age, as we advance with the age, the risk of developing cancer also increases. Hereditary factor is also there in the breast cancer. BRCA1 and 2 is an inherited gene mutated gene if it is there. Breast cancer, ovarian cancer, uterine cancer, all these cancers are hormone related. Obesity. When you are obese, the fat cells also produce estrogen, which can again cause as a risk factor for these people. Early menarche, late menopause, because that lady is exposed to a large amount of hormones, they also come under risk factor. When it comes to the uterine cervix, early marriage, that is before the age of 18 or 17 when they get married, they have the opportunity to go into sexual intercourse much earlier. Because of that, the sperma-columnar junction, which is low-lying at that age, gets completely bruised again and again, and they can develop cancer in the future. Human papilloma virus, again, is a risk factor for cervical malignancy. Multiparity, more number of children, also is a cause for cervical cancer. And multiple sexual partners are also a cause. Lifestyle, poor genital hygiene, a poor diet, sedentary lifestyle, stress. Stress is also a factor which can be contributing for the health of the breast also. So there are multiple risk factors which can affect, like certain risk factors are more for the breast cancer, and certain risk factors like HPV virus and all is more for the uterine cervical cancer. So these are the various risk factors I could think of.